According to a recent study, inaccurate or delayed diagnosis is the most common and costly of medical errors. Joining us to discuss how to combat this problem is Dr. David Newman-Toker, a professor of neurology at Johns Hopkins. Welcome.
Thank you very much for having me.
This is a very interesting study to me. Can you tell me a little bit about some of the biggest findings that you found?
Sure. So your viewers have probably heard of medical errors, but they may not have heard of diagnostic errors. And we did a large study of medical malpractice claims from around the United States and found that diagnostic errors are the most common, most catastrophic, and most costly of medical errors. In fact, they accounted for about 1/3 of all the serious harms, that's permanent disability or death, that result from medical error. And that's the #1 cause.
So what impact does misdiagnosis have on health? I mean, I know that's the extreme, but just in treating whatever ailment that you're dealing with.
Sure. Well, diagnostic errors are incredibly common. They occur throughout medicine, and sometimes the diagnostic errors are things that cause delay or a lack of treatment for a period of time, but then everything turns out okay. Sometimes, unfortunately, the disease that's underlying that gets missed it causes serious harm before we figure out the right diagnosis. And that's most common with 3 groups of diseases that we found in the study. That's vascular events, infections, and cancer. So vascular events like stroke and heart attack, infections like sepsis and meningitis, and cancers like lung cancer and colon cancer. These diseases together account for 3/4 of all the serious harms from diagnostic error. So when the diagnostic error occurs with one of these diseases, that's when it has the biggest impact on patient health.
So how should people talk with their doctors about this issue? Because I feel like we're the laymen, we're going to the doctors because they're supposed to be the experts. So how do we ask them if the diagnosis is actually correct, if we have some misgivings?
Sure. Well, that's a great question. And it's hard as a patient to know what to do. What I usually tell my patients is 3 things. They need to do one thing before, one during, and one after the encounter with a provider. Beforehand, what they need to do is come prepared. So they need to prepare a brief written summary of their symptoms and the timeline of their problems so that when they're seeing the doctor can focus on thinking about what's causing the symptoms and problems rather than just gathering data. Then during the encounter, the patient really needs to ask good questions, specifically things like, what's the worst thing this could be, and why isn't it that? If the doctor can't give them a good answer or seems offended that they asked, they should probably seek a second opinion. And finally, when they leave the doctor's office, they need to stay vigilant about the possibility of diagnostic error. Usually people leave the doctor's office with a diagnosis and a treatment, and if they're not getting better, they assume it's because the treatment's not working. But it might be that they have the right treatment for the wrong disease. And if that's the case, they need to go back and get a better diagnosis and the right treatment, hopefully before it's too late.
So basically, patients should feel empowered to question their medical providers if they do have these misgivings.
Absolutely. It's critically important that patients feel empowered.
All right, great. Thank you so much for joining us today, Doctor. Really important information. You can learn more at improveddiagnosis.org. We'll be right back right after this. Stay tuned.